You're listening to the Jōrni Podcast. Bladder control seems simple, but what if most of it isn't actually under our control? We're lifting the lid today, so stay tuned. This episode contains adult subject matter and listener discretion is advised. Hi, I'm Petra Brunbauer, and with decades of experience with sadness, pain, anxiety, and stress, I finally figured out how to leave all that behind. And this podcast shows you how to break free permanently so you can reclaim your sanity and find the self-esteem and energy to go after the life you desire. With real talk about mental health, holistic healing, and the tough journey of coming out the other end. This is the Jōrni Podcast. Welcome to today's episode. In this episode, we explore how bladder control issues can shape the way we live. We talk about the constant planning, the embarrassment, and the shame that keeps so many of us from enjoying life fully. These struggles are often carried in silence, and over time, they can shrink our confidence and our freedom. Dr. Nigel Brayer is the creator of the ironclad bladder system. His journey into natural healing began in his early 20s, when years of unexplained pain left him nearly disabled, until a chiropractor uncovered the real cause. Within weeks, he was pain-free, an experience that transformed his view of medicine and inspired his career. For more than 27 years, Dr. Brayer has dedicated his work to natural approaches that support the body's ability to heal. In his practice, he has helped women of all ages regain bladder control and confidence through simple, effective methods they can practice at home. His mission is clear. When you give the body what it needs, it will respond. Let's meet Dr. Nigel Brayer. Hi, Dr. Nigel. It's so great to have you on the podcast today. I've been looking forward to getting to chat with you, and we will be talking about leaky bladder syndrome today. A little bit unexpected, but I have a feeling there are many listeners that can identify with that, and we don't so often talk about it openly. So thank you for joining me today, and welcome to the podcast.
Thank you, Petra. I appreciate your time and this opportunity to chat.
Yeah, absolutely. I'm always happy to share information that is really valuable to our listeners. And I have a feeling this is going to be one of these things that come out of left field, but that are so important to talk about. So let's start off with maybe a little bit about yourself. And maybe you want to share the parts of your story or your journey that you feel are connected to what you do today, what brought you to what you do today, and share with our listeners also what it is that you do today.
Sure. That's a big ask, a big question. So I'll try to bring it into kind of a synced pathway here. I've been in the natural wellness, functional medicine, chiropractic, acupuncture sphere for 27, 28 years now. I've had a lot of different focuses over the years, from orthopedic issues to gastrointestinal issues. But the last several years, I've been more focused on bladder-related problems. And like most things in life, it's not something I necessarily chose to do or even wanted to do for that matter. But I would say I was led to do it purely out of self-preservation. A lot of people do things out of pure altruistic purposes. I didn't. I did this because I was trying to help my wife, which inadvertently was helping me. How this whole process got started and how I started to specialize in bladder health in general was I have 4 children, and my youngest is 7. And the birth of him was very traumatic on my wife. And after that delivery, she had a lot of challenges. But of course, being a new mother, there's a lot of challenges, from sleep deprivation to healing from trauma to emotions and hormones. She started losing her ability to control her bladder shortly after childbirth. But like most of these traumas of life, is in time they get better. In time, hers got worse. And so pretty much a year postpartum, her bladder control was so out of control that she really stopped living. She stopped going places, she stopped exercising, she stopped traveling. And I'm not talking long travel, just grocery store travel. After much discussion and tears and heartfelt understanding and I didn't know any of this at that time, it was kind of hidden, which kind of give me some real insight into this issue itself, is there's enormous amounts of shame, and I'll call it just self guilt, I guess, about the inability of bladder control. And again, this was my wife. I've had a close relationship to her for years. And I thought to myself, she didn't share this with me because of what she felt. Imagine how a stranger would feel sharing with another stranger. Again, and this is all hindsight on my part now, but it helped me understand that this condition isn't just about the physical ability to control bladder function. It's so much deeper. It goes deep into our ability to have self-worth. My belief in is it's one of the first milestones that we have as a human being. Where's the milestone? You're born, then you learn how to eat solid food, then you learn how to control your bladder, then you learn how to it's a milestone. I've reflected on this a lot, is why is there so much stigma attached to this problem? Is I think that a lot of a person's self-worth is attached to it. A long story short is once I realized what was going on with my wife, I did what any caring spouse I believe would do, is I said, let's talk to a doctor and let's get it fixed so we can move along, right? And so we went through that pathway. We went to her OBGYN or gynecologist, excuse me, and she did an evaluation and she looked and said, hey, everything's fine. All the anatomy's there. It's fine. It's not scarred. It's not traumatized. Let's go to physical therapy, have some pelvic floor therapy done. Problem solved. We'll see you in 8 weeks. So, of course, she went through that process. And 8 weeks later, she returned and she had about a 20% improvement. 20% improvement is not great, right? So I went back and the doctor said, hey, we've exhausted this. Now let's look into other options. We looked into Botox as an injectable to help the nerve or stop the nerves from functioning. We looked into beta blockers, which affects the sympathetic nervous system. We looked into urethral slings, which is a surgical procedure. And then after all this discussion, first, there was no real good options, but they were all dramatic options. And at the time, my wife was in her late 30s, and we're like, this is not good options at all. Being a physician in the natural world, I said, hey, this doesn't make sense to me because in my experience, the body is really good at taking care of itself when you give it what it needs and you support that process. I started diving deep into the anatomy and physiology of the bladder, the kidneys, the urethras, the ureter, which for those out there, the bladder is like a balloon. The urethra is a tube coming out of the balloon and that exits our body. And then we have valves called sphincters that control that tube. But what was really fascinating to me is the anatomy and the bladder, the urethras, the kidneys, etc. But here's where the big aha moment came in for me when I was studying, is that sphincter, okay, is controlled only 30% by your conscious control. The other 70% is controlled by your autonomic nervous system. So what that means is when I put my arm to my face, I consciously move that. A brain nerve impulse moves the muscle. It brought my arm closer. My autonomic nervous system, that's the system that's beating my heart, digesting my food, controlling my blood vessel diameter, all those things, that's happening without my knowledge. And it's happening as a result of what's called my autonomic tone. And I'll get to what that means in a second. But the epiphany for me is that sphincter is 70% autonomically controlled, meaning you don't control it. So if we put that into perspective, and this helps me understand why the physical therapy was so limited in helping my wife, is they were working on the 30%. In my reasoning, I said, why don't I look into the 70% and how do I influence that? And so that's kind of where I went deeper down the rabbit hole into my acupuncture training and some of my neurofeedback training and such, and my neurosomatic functional training. And I said, hey, if we can start to influence the autonomic nervous system, it reasons to me that we can get to the bottom of the bladder issues because we knew it wasn't a physical problem. And so from there, I went into my patient database and I started reviewing some of the patient files of my other lady patients. And we do what's called a review of systems, which just means review things for conditions other than what maybe somebody's coming to see me for. If you're coming to see me because you have an orthopedic problem, we want to ask you about your digestion, let's say. We would ask about the urinary system too. And I found that an enormous amount of my patients had urinary complaints that I never even knew about. So as these ladies started coming in for other reasons, I would ask them, I'd open their file and I'd ask them, well, how's the urinary issues? And pretty much every one of them, they were still there or they've gotten worse. And then they would go to the next step is they would use diapers or pads as an adjunct to get through, which to me just didn't make sense because ongoing use for the rest of your life is never a sentence any of us want. What I did is I started putting together different processes in my office and testing it out on these patients with their permission, of course, saying, hey, are you willing to try these? And over the next several years, I did that. And with my wife also, I did that is I said, hey, let's try this technique. I pulled on some of my acupuncture training. I said, let's start doing this daily and see what happens. Let's start doing this twice a day and see what happens. And then I found this really powerful tool. It's called the QUID test, which you can use to quantify how severe bladder leakage issues are. And I started using that quantitative measure as our guide of effectiveness. So I did this time and time again. And after I got the system dialed in, then I said, what are the biggest barriers for people getting help for this condition? So of the over 100 women that I worked with at my office, pretty much most of them never talked to their doctor about it because they're embarrassed. So there was the emotional factor. And the second they didn't talk to them about it is because of expense. So the two big barriers were the emotional component and the financial component. I said, can I take what I've done in my office with success for my wife and these people, and can I put it in a system that first avoids those uncomfortable conversations? I still think it's important to have them, but let's be honest, is a lot of people are going to spend their life avoiding their pain points. Should they do that? Probably not, but that's not I'm not the one to judge that. But I do know that they have these conditions that if they don't address, it's going to negatively affect their life. So I put this program together and then I said, how do I get it to people and not cost an arm and a leg? Because I'm in America and healthcare system is fine enough, but it's expensive. And so if you don't have a lot of money, it's hard to get good healthcare. How do I put it together so they can get these great benefits at very inexpensively? And that's where the Ironclad Bladder program kind of evolved. And like I said before, is I didn't wake up in one prophetic dream one night and say, I want to do this, and this is where I'm to be led. It was like, no, I really want my wife back so that she can be part of our family and do what she loves because I know how that affects her. And then, of course, as I look into the statistics, is this affects literally hundreds of millions of women worldwide. This isn't like a 1% issue. This is a 50-60% of the population issue, which there's just a huge gap. So my hope is to be able to help buffer that a little bit.
Thank you for sharing that. And an interesting journey you have been on, and so fascinating what you have discovered and put into your program and packaged. And I keep hearing you mention women. Is this something that is much more prevalent for women, or does this also happen to men? Because I'm getting the sense that this is much more common for women. And if that is the case, why would that be?
Sure. It's much, much more common in women. I'll just give you my medical assessment of the why. Obviously, there's anatomical differences. Okay. From the physical is the urethra in a female, which is the tube from the bladder outside the body, is approximately 3 inches long. What's that? Like 7 or 8 centimeters or so, right? It's not very long. In a male, it's anywhere between 6 to 10 inches long. And you have two very distinctive sphincters, right? In a male, you have the external, which is right where the bladder, so think of a balloon with a straw, it's right where the straw and the balloon meet. And then you have one at the other end where the straw exits into the environment, the air, right? Women, you have both together and they're all conglomerated. So it's very short, okay? And the whole sphincter is determined by the one of how it's working, right? You don't have two. So there's that issue. Then you also have hormones that are in a constant state of flux every month. Okay. So when we look at hormones, we have progesterone, which is the builder. So any of your listeners who are moms, if they can reflect back to when they were pregnant, is a lot of moms in their second trimester after the first 3 months, they usually start to feel amazing. And the reason they feel amazing is progesterone, which this is a loose analogy, but is like the female testosterone. It's a builder. It gives energy, it gives lubrication, it gives metabolism. Their body and their tissues are very responsive. Okay. But then you also have estrogen. So if you think about the female cycle, is progesterone's produced after ovulation. That means the egg is released and then the outer part of the egg produces that hormone. But the beginning of the cycles is producing estrogen from the pituitary gland, and that's holding on to things. It's restricting, it's tightening, it's holding on, it's preventing metabolism, it's getting the body ready. It's almost like making an environment suitable for the growth of something else. And to do that, you have to reel in your resources to get it ready in case an egg comes and implants. That's happening every single month. Those tissues aren't just the uterus we're talking about right now. So the uterus is the most evident, but it's affecting your blood vessels. It's affecting your muscles. It's affecting linings of your bladder, linings of your urethra, your blood vessels. But then there's also an emotional component. When we look at the autonomic nervous system and you talk to any woman, she's going to tell you at certain times of the month she's happier, certain times of the month she's unhappy. It's up and down, and it's not because there's something cerebrally wrong. It's hormones influence the nervous system. It doesn't just affect the brain part of the nervous system, it affects all the nervous system. So you just got so many variables happening all the time. But then you add in the next step is childbirth. Childbirth is a glorious but traumatic event. And our body's equipped to overcome those things. Traumatic events don't always go the way you'd hope they had, right? So sometimes they create scarring. Sometimes there's episiotomies, which create more scarring. Sometimes there's C-sections, which create more scarring. There's just a lot of different variables that are affecting it. And I guess what I want women out there to know is none of these are bad. These are just things that happen, and our body's well equipped to balance them. But when it can't balance them, then dysfunction has to occur. And the dysfunction we're talking about now, leaky bladder issue, which is extremely common, but dysfunction can also show up as digestive issues. It can also show up as high blood pressure. It can show up as heart issues. So it's not so much that what we're talking about is so specific to just the bladder. What we're talking about is specific to health in general. Does that make sense?
Yeah, that's a really good point that you're making. And thank you for sharing that, because that is the thing. If we are innately meant to heal, but there are challenges and obstacles happening that don't allow that, it will happen in different parts of our mind, body, wherever that comes out. So the bladder, I guess, is just one of those places that will occur. And I guess that's outside of having actual physical damage to a bladder where that might be the case, but we're talking hormonal, we're talking stress, we're really talking things that could balance themselves. So that makes a lot of sense. And I'm very curious, if our control of the bladder is only 30% conscious, how do we work with these other 70%, which is the majority of how the bladder gets controlled? I feel like most women are definitely not aware of that whatsoever. And so, where do you start when you want to work on that?
I think the first place, Petra, is to start with understanding of the basics of the nervous system. Okay. So you've got the conscious. Okay, let's put that aside. Then you have the autonomic, which is the unconsciously controlled. And that's made up of two different pathways, what's called the parasympathetic, which is the healing, restoring, repairing, and then the sympathetic, which is the protecting, the striving, the pushing, the protection of self. Okay. So most first world nation people in general are what are called sympathetic dominant. Okay. I'll just preface that is the number one cause of death in most first world nations is heart disease. Does that mean that first world nations have bad hearts? And the answer is no. But first world nations are sympathetic dominant, which has a high effect on your heart and your blood vessels and your metabolism. That dominance is not only influencing your heart, which invariably leads to a lot of people's deaths, but that's affecting your general tone of all other parts of your nervous system. So if I was consulting a patient, said, "Hey, doc, help me lose weight." This is a big topic for people. Help me lose weight. Tell me what to eat, prescribe a drug. I want to drop 50 pounds. There's drugs to do that, which, of course, that's a whole other topic I'm not a big believer in. But it all relates back to the sympathetic nervous system. Your body can't repair itself while it's under attack. And that attack doesn't have to be actually real, it just has to be perceived. Now, what does that attack mean? Well, that attack means like juggling 1,000 things in our life, juggling children and work and spouse and deadlines and being perfect mom and going to every soccer game and doing all this and doing all that. Just telling you makes me feel anxious. That affects our sympathetic tone. And that's the tone unconsciously that's healing us or allowing us to be broken down. Okay. So the question comes, how do you retrain that? As you start retraining that, and this is what our system does, is it starts by being present. By being present, we start to acknowledge the here, the now. And it's not as simple as just breathing, but that's the first step, is just stopping and putting a pathway in place that makes it simple so we can start taking these steps to balance out that stress, that anxiety, that angst, that the one that kind of, it's been there for so long for so many people, they don't even know it's there. If I talk to a patient and I explain the sympathetic, parasympathetic, and they're like, "Oh, that sounds neat," and they can see it in everyone else, but they won't see it in themselves because it's almost like the slow boil. Is it happened over 20 years? It didn't happen yesterday. The key is to, over time, undoing that dial. And what happens is, and with some key techniques to rebuild the neural connections, is then the whole system, instead of being like this, it can start to relax. But that's not a take this drug or do this one technique, it all undoes. It's a take these steps regularly in small doses, and then your body starts to let go. And what happens in time is your function, bladder function, mental function, digestive function, all those things start to repair and improve.
That makes a lot of sense when you explain that, because I feel like if this affects mostly women, I'm probably in that category too, not consciously aware of it, but I have definitely noticed that in times of high stress and times of a lot of grief or loss where the nervous system is under a lot of stress, there are different things going on in the body. And you may actually feel like, oh, I'm not going to drink a tea this morning because I know I have to go shopping and then I just have to go look for a bathroom. And that becomes more prevalent, I think, when you are really stressed. That makes a lot of sense. And I think a lot of our listeners can probably identify with that. And I hear other women say all the time, yes, when I go exercise, I don't drink anything in the morning because then I know I just have to go find a bathroom. Or when I go on road trips, we measure ourselves and we try to control what we can around that, when maybe the better solution would be to work with our nervous system to begin with to help heal that. Fascinating. Yeah.
Yeah, just kind of piggyback off of that note is a lot of these issues, and I'll speak about my wife in particular, is childbirth, and we can all agree on this, has a lot of challenges that go along with it. And so oftentimes these conditions, the bladder in particular, is initiated by a traumatic event. Childbirth's an easy one to talk about because it's easy to understand because of the uterus position. But I've heard a lot with people who've had divorces or who had major job problems or had child issues, whatever it might be, is it's not just the physical birth issue, although that's a big one. It's also catalytic events. Okay. And so those are the events that push us over the edge. But you were already near the edge. It's not like you were 10 miles away from the edge. You were right there and it pushed you over. So I guess what I'm hoping people understand from this is some people might listen and say, my bladder works fine. I don't have to worry about it. but I'm anxious and I'm overwhelmed and I get headaches and I have irritable bowel issues. My stomach's really sensitive when I'm nervous. These are all signs of what we're talking about. It just tends to manifest in a different way. Okay. So human beings, we like to make it. That doesn't mean me. I'm going to move along and I'm going to turn it off. But this is affecting all of us, men included, by the way. So let's go back to your earlier question about male versus female is yes, male's anatomy makes that less likely, but it shows up in a different way. It shows up in hormone imbalances. It shows up in stress. It shows up in a myriad of different ways, but it's the same cause, right? So these things we're talking about really are universal.
Yeah, all goes back to the nervous system. And as you said, probably in first world situations, one of the major things that we are dealing with that are underpinning not just leaky bladder, but many other chronic condition, chronic illnesses, pain, anything that you want to throw into that pot that's connected to stress. I can definitely see how that comes together. Now, I'm curious because you mentioned that your wife really suffered from a loss of quality of life, aside from physical things that were happening at the time as well. Do you find that is a very common occurrence when you see female clients or patients, that it doesn't just affect how we feel in our bodies, but it also affects our entire lives because we start making concessions, we start putting limits on what we can or can't do because there's an embarrassment and a shame that goes with what happens if you can't have control over your bladder. How do you work with the psychological impacts of having leaky bladder syndrome?
I would say that's probably the biggest impairment right there of this condition in general. The physicality is the physicality, right? The emotional attachment that we have to the event is really the biggest challenge. So I think one of the things that we want everyone to take away from is this isn't a self-worth issue, meaning I'm not a bad person. I'm not a less than person because of this. Now, many people believe that, but by part of having dialogues like this is you get to open up a forum of saying, first of all, other people experience this. It's not just me. Because remember, human nature is we think we're the only ones with the only thing and nobody else understands us, right? So by having communications with others or listening to podcasts like this, is people realize, hey, this is extremely common. I'm not inherently flawed. I'm not a bad person or I'm not a less of a person because of that. So I think just kind of acknowledging that, first of all, because we can never address something we're unaware of. A good example, if somebody has emotional anger issues and they deny that they have them or are not aware of them, they can't ever overcome them. But the moment they say, you know what, I have a real problem managing anger, that's opening you up to different options. And the same goes with the bladder or any other condition, is saying, you know what, I have a real problem with this. I am not damaged because of it. I'm not less than. From that standpoint, then it can be okay, now how do I move forward? And that acceptance is really the big first key, because there's a saying is what we resist persists, right? Is we can never overcome something from resistance because there's always somebody with a stronger or bigger or whatever it might be. The only way to overcome anything is acceptance, right? So when we accept, hey, I don't necessarily like where I'm at, but I'm not less than because of it, that opens the door to not only am I creating less stress, remember, is that judgment that we hold upon ourselves is also creating more angst, more sympathetic, more protection response. And that's what accommodations do, is we say, hey, I don't want to be embarrassed if I can't control myself. So how am I going to protect myself? Remember, this is fight or flight. How am I going to protect myself from embarrassment? I'm going to stay home, right? How am I going to protect myself from the judgments of others? I'm not going to go to whatever it might be. So the concessions, our life gets smaller. And in my book, that's part of our program, is it has a bunch of stories of women just like this, of how their life got so small because of that protection mechanism, which is adding more of that fight flight, remember? So accepting it is reducing, of saying, I'm not going to fight it anymore. I don't necessarily have the answers, but I'm not going to fight at least. And that moment of surrender and acceptance then opens pathways that you couldn't have comprehended previously.
Yeah, I imagine that there would also be a sense of relief being able to share this with someone and then finding out that this is such a really common thing that happens when we stay in that isolation. And that happens a lot with physical illnesses, chronic illnesses, or pain or mental health challenges. We think that we have to deal with this in isolation because no one else will understand. And I think there must be just relief at finding out there's support, there's help, there is 50 to 60% of other women going through this as well. I find that in itself can also be a piece of that healing journey, is connecting with the fact that we are not alone in this. That sounds amazing. And I just want to ask you because I have a feeling that some women might be a little bit hesitant to share this maybe with a male doctor or a male coach or counselor. So, how do you tune in when you feel that women might have some of these issues? And how do you work with the fact that they may feel like you can't understand what they're going through because you haven't gone through that yourself? How does that come up in your practice and when you're working with your clients?
Yeah, I think, and that's a question I get a lot. And I like to reflect on this is there's an old saying to get out of the muck, the quagmire, you have to step outside of the quagmire. So that means is the answer isn't within staying in the mud. If you think of this condition as, I won't say exclusively, but much more commonly a female issue, is I'll say is a female's perspective is they're definitely more emotionally connected to the condition because they're living it. But I would say that one of my, I would say, superpowers with dealing with this is I've never experienced it to the same degree, of course. I certainly can empathize, but don't get caught up in the quagmire of the moments. I think of it like a leader. Is a leader can empathize with somebody going through a process and maybe they've experienced it themselves, maybe they haven't, but they can see the path much further ahead from their vantage point. I've come to realize that me not being a female is more of a strength than it is a weakness because again, is through my years of patient care, I can definitely know the suffering that they've experienced it because I've seen and experienced all sorts of suffering in my life and otherwise, not for the exact same topic, but by seeing the path ahead and knowing the steps that take, I don't get drug into the moments of doubt and fear and anxiety, which come along with a long-standing problem. So I feel like I'm well equipped to be able to take people on that path without being pulled back into past.
Yeah. And those can be very emotional journeys when we're talking about our own healing and we've suffered maybe for many years with something that we don't like to talk about. I think that would feel really good to have somebody who can clearly tell you, look, there is a way. We can do this together. There is a way. Don't worry, we're going to find that path. So, yeah, that sounds very supportive and empowering also for women who have just not found any answers to this problem. So, wonderful. And do you want to share maybe a little bit about any programs or services that you have available? So, if our listeners are curious or they maybe are experiencing leaky bladder syndrome and they want to have some help, some support, or connect with you, how can they do that? And what do you have available?
I developed the same program that we used with my wife, and I've used for several years in my practice. I've put it online in an online format that people can download anytime. It's a 30-day program. It really takes everything we've talked about, the physical, the nutritional, chemical, hormonal, and the mental, emotional factors that influence our nervous system, as well as addressing the anatomy and the physiology and restoring that function. So, just a side note, I'm not denying that physical issues affect the bladder, but 70% aren't. So with our program, we do all 100%, right? I made it a program that people can do at home. I fully understand that talking to doctors can be overwhelming. Talking about this condition can be embarrassing and overwhelming. So I really have had a desire to remove those two barriers. And I wanted to make it online, easy and simple. I'm a simple guy and I like to make things simple for others because complicated things are complicated, right? And then what happens is follow through becomes minimal and people become overwhelmed. That's a program that I have on my website, drnigelbrayer.com. And it's downloadable, it's very cost effective, and people can really start it right away. And we'll generally see, depending on severity, and all this is in the program, is people can see changes in as little as a few days. I've had patients that we've had to do months and months worth of stuff because they, let's say, had cancer or radiation or scar tissue. Those are more complicated. But for the majority of people, within 30 days, they can have almost complete resolution. It's not like, hey, does this have to be a 5-year journey or a 1-year journey? Sometimes that's the case, but most of the time it's not. I guess what I'm trying to say is we don't have to tackle all of our challenges all at once, right? Do we have to overcome these fear and this anxiety and these past conditionings? Those take a lifetime. We don't have to address every ghost and goblin in our closet, but taking a first step and getting some success, getting some of your life back, feeling empowered, that takes us to the next level. And that will allow the evolution. I guess that's my platform, my job, and the bladder for most women is a really powerful place to start.
Amazing. Thank you for sharing that. And we, of course, will be linking to all of Dr. Nigel's offerings in the show notes as well. Be sure to check there for his website for where you can find the program. And of course, you can connect if you have questions or you'd like to know more. Feel free to reach out and ask these questions that may have been there for years and you maybe didn't want to ask them to your healthcare provider or your doctor because there was a lot of fear or shame or anxiety attached to that. And now that you might be finding out that there's many other women who are going through the same thing, maybe that will create a little opening to feel comfortable to ask those questions and start on that healing journey. Thank you, Dr. Nigel, for joining me today and shedding some light on what goes on when we experience leaky bladder syndrome. And thank you for talking about that so openly. I really appreciate it. And I hope that we've brought a lot of interesting things to our listeners and they find some pieces they can pick up on their own healing journey. Thank you.
Thank you, Petra. I hope I was informative and tried to simplify a kind of a complex topic. So that was my goal.
Absolutely. I feel there's a lot that goes into the anatomy and the nervous system, and the way that you presented that, I feel so understandable that women can definitely identify with that and understand what might be happening in their bodies. I truly appreciate it. I appreciate you sharing your wisdom around this topic and the solutions that you have found. So thank you so very much for joining me today and take really good care of yourself.
Thank you so much.
Thank you so much for taking time out of your day to listen in. If you enjoy the Jōrni Podcast, please support us by subscribing, sharing on social media, and leaving us a review. We appreciate you. And you can find more of The Jōrni on Facebook, Instagram, TikTok, and our website, thejōrni.com. Sending you love and courage, and see you next time.